Are the models that you're studying showing that America is making progress on flattening the curve of this pandemic, or is the situation getting worse before it gets any better?
Well, in some parts of the country that have really put the lockdown measures in place, well, they've now moved to a place where case rates are doubling every 6 to 7 days instead of every 3 days. And in New York, which put lockdown in place 14 days ago, today's the first day that they've seen decrease in hospitalization, kind of right on schedule. So I think there's good early signs. I think it would be a mistake for people in the US to think that because of these good early signs, it was time to take the foot off gas. It's actually how long and how well we're able to sustain this is, I think, that's going to make the biggest difference. But I think that we are seeing good first early signs.
Andy, tell me about the situation on the ground right now. We hear continuous reports of a shortage of medical supplies, materials and logistics support to fight the virus. Why aren't frontline staff in the world's most sophisticated economy getting the kit that they need to fight this?
Well, so it depends on who you believe. If you believe the president, everybody's fine. But there was an Office of the Inspector General report, which is a service in the United States that's really charged with keeping track of what the government says and does. And it released a scathing report today saying there was indeed a shortage. All of this comes from a lack of preparation. I think, unlike many of the countries in Asia, the U.S. spent the first month and a half to 2 months really not taking action, not jumping on the supply chain issues. Meanwhile, hundreds of countries around the world began to do that. And it's one thing if you're behind. We've all been behind before, and we can work the weekend or work all night, catch up. But when you're behind something that is growing exponentially, like a virus, it's really hard to catch up. It's a bit like swimming after a speedboat that's 15 feet in front of you, and by the time you get 15 feet, the speedboat's 100 feet in front of you. And so people are working the best they can. I think it's the spirit of cooperation, moving things across state lines and getting more serious about it that's going to take to close the gap.
No, I hear you, Andy. It's a moving target, and whenever you feel like you're catching up, it's actually further away, and there's more ground to cover. I want to ask you about this, though. I know this is controversial. The malaria drug, hydroxychloroquine. It's become, in just a matter of weeks, it's become the standard for treatment in some of the hardest hit areas in the U.S., including New York. But I mean, and this is something obviously that the president has been touting widely and repeatedly also. Does it concern you that this has become the standard of treatment, barring, let's say, a vaccine, whenever that does become available, even when doctors acknowledge that, look, the benefits are really unknown, whether it works or not is unknown. We do know, though, that potentially the side effects could be vision loss and heart problems. I mean, it sounds dangerous. Is it?
The other side effects are that there are people with lupus and other conditions that are going to have more difficulty and are having more difficulty getting their medication. And look, we ought to take our scientific advice from the scientists. We ought to take our political advice from the politicians. And so sometimes the best answer is we don't know. And if you listen to Dr. Fauci, who is the scientist in our country here in the U.S., who is really supposed to be guiding the way, he says we don't know yet. And if we don't know yet, we have to acknowledge and appreciate that there's much more we don't know than that we will know. And so I know that the president is hopeful, but we don't want to base a strategy on hopes. I think we will be able to test things rapidly. There are potentially good drugs around the corner. That may or may not be one of them. But let's let the scientists guide us here, because, as you say, the harms here can be quite consequential.
What would the ideal or optimum medical and healthcare worker response, what should it be if and when there are patients who are so desperate for help, they're going, hey, I hear about this drug, this malaria drug, which has been around for decades. Give it to me. I want to try it.
Well, I'm not the right person to make that clinical judgment either. So I think we have health commissioners, we have senior medical leaders and scientific officers that are really should be driving those decisions from the CDC. And so as they hear guidance from the CDC, and I think the CDC has to be more active about what's working and what's not. And don't hear me wrong, I'm not suggesting that we need to prove everything to the nth degree, but I think we need to know many more medical things and many more medical best practices that are in the course of this process that are getting out there. We've heard today about 3 risk factors that make somebody more likely to have a severe case. We've heard about people who have prolonged exposure being more likely to have serious illness. We don't yet know if these things are true, but we should have our best investigators run down these paths and figure out who to give early therapy.
Got it. Okay, listen, Andy, we wish you had more time. Thank you for talking to us. Appreciate it very much. Andy Slavitt there from the Centers for Medicare and Medicaid Services. We'll take a quick break on Squawk. We're back in 2. Don't go away.